So April, I know that you came here to get a PAP, and obviously you've had your exam, and they were going to check for vaginal infections while you were here, and I know they did other testing.
Right.
In terms of testing for STDs.
Yeah.
But I wanted to talk to you a little bit about, prevention, because we talk to everybody that comes here to an STD clinic about preventing STDs and, also HIV, obviously.
Okay.
So why don't you talk to me a little bit about your partner situation right now? What's your...
Oh gosh, I haven't had sex in 5 years.
Okay. Okay. And at that time, 5 years ago, was it a regular partner, different partners that you were involved in?
Oh, well, I kind of went through this crazy stage and had a bunch of different partners after I got divorced.
Okay.
And so, yeah, there were a bunch. But then, just kind of straightened my act out and...
Okay. So no contact for 5 years?
Right.
Okay. And then what about in terms of your history of getting tested for HIV and STDs?
I got tested when I was pregnant with my second child.
Okay.
So...
How old is that child?
He's 12 now.
Okay. So you're pregnant, and obviously they were doing the testing then, right?
Yeah.
Do you have other children?
I have a 15-year-old daughter.
Okay. And the 12-year-old, is that a male or female?
Male.
Okay. Good. Okay. And so you're not thinking that you need a test again today, the HIV test?
Oh, no. I mean, I haven't had sex in 5 years.
Okay.
So...
And how about in terms of any experience with substance use in the past or present?
Oh, maybe a little during that crazy part.
Okay.
But none lately. I've been focusing on my family and raising my kids.
Great. Sounds like your kids are important to you.
Yeah, they are.
Good. Good. So when you said a little bit, was it like what kind of drugs or at the time?
Well, alcohol, little marijuana, maybe a little coke.
Okay. And any needle use, like injecting anything?
No.
And how about the people that you were seeing at the time, do you think, in terms of drug use?
Oh, some of them, I have no idea.
Yeah.
Yeah.
But some of them use some other kind of drugs, you think?
Oh, yeah. Yeah.
Okay.
There's a lot of drugs
A lot
around.
of drug use, yeah. Okay. Okay. So, we do recommend the HIV test for everybody that comes in particular if you haven't been tested recently. And it sounds like you're saying to me that you're not seeing a need for this because you haven't had sex in 5 years.
Right.
Okay? And you're not currently involved with anybody.
Right.
Okay. So this is a demonstration of a behavioral risk assessment for a different patient, April. And April is not sexually active and hasn't been sexually active for 5 years. So really condom use is not the preventive strategy that we need to explore with her. We did, however, talk about substance use. She doesn't have a history of needle use in terms of substance use, but she did involve herself with different people who use recreational drugs, and she used recreational drugs. She's not sure whether any of her partners at that time, after her divorce, where she was seeing multiple partners, were using needles at all or not in terms of drug use. But the focus today is on HIV testing because she said she was tested 12 years ago during her last pregnancy, but she hasn't had a test since. So the target behavior for today's behavioral counseling session will be to get her to see the need for testing, because currently she is pre-contemplated for testing and doesn't see the need at all because she's not having sex. So April, what you're saying is you're not seeing a need for an HIV test today because you're not having sex.
Yeah.
And I understand, right?
Yeah.
The one thing about HIV, though, that's a little bit different than other kinds of sexually transmitted infections is that a person can be affected for actually 10 years and not have any symptoms at all. So I'm just thinking to myself, you said your last HIV test was 12 years ago, right? And then, no involvement, no partners in the last 5 years, right?
Right.
But then during that time, maybe 6, 7 years, what was going on for you, you said?
Crazy time.
Okay.
Yeah.
And different partners, long-term, short-term, different?
Oh, Yeah, short term.
Okay.
Yeah.
And how did you meet up with these people?
They were mainly at parties or rock concerts or, you know, that kind of thing.
So after your
On the
divorce, you were
road.
having some fun again?
Yeah.
Okay. Okay, good.
Yeah.
And so you said you're not sure what some of them were doing in terms of drug use, right?
Oh, yeah, I'm sure a lot of them were into a lot of different things.
Okay.
But I don't, you know, I feel fine, so I really don't think I need another HIV test.
Yeah. No, I hear you, and I understand what you're saying. It's just that this whole issue about how long a person can have HIV without any symptoms is what is a concern here, okay?
Okay.
Because I'm just raising the possibility that obviously you were not HIV positive 12 years ago when you had your son, but, you know, during this time you had different partners, and in terms of condom use,
Oh, no.
yeah, not really, not too much.
No.
Yeah, so I'm just concerned about whether something could have happened, you know, during that period of time that is maybe potentially impacting you now. Like, maybe perhaps if somebody was using drugs, you know, people that get HIV can get HIV from sharing needles too, not just from having sex. Like for shooting up cocaine or heroin or, you know, different drugs, different recreational drugs. And so I guess I'm just thinking about your scenario. I mean, you're here taking care of your 2 kids.
So are you saying that if somebody back here had it, I could be way down here and still not have any symptoms?
That's true. And actually HIV is being, you know, diagnosed in women who are older. You think of, you know, STDs as a young person's disease, but because
Yeah.
it has that whole 10-year period, you know, where you can have it and not know, women, you know, your age and older are being tested and then, you know, find out that they've had something all this time that they didn't know. And I guess I'm thinking about, you know, you're taking care of your kids, right? And you obviously are very close to them and are very involved in your motherhood role.
Yeah.
And so if something were to happen to your health, how do you think it would impact on them?
They would be devastated because I finally just got them back in my life 5 years ago.
Okay. So you sort of feel like you've started over with them a little bit in terms of how your relationship has been in the last 5 years compared to before.
Yeah.
Well, what do you think about making sure that something else didn't carry forward from that time too?
I think that I better get an HIV test.
Is that what you want to do?
Yeah.
Okay. Well, you know, it's not a likelihood, but it is a possibility. And so I think it's, you know, being very mindful of taking care of yourself. I can see that, you know, you want to take care of yourself because of your family situation and because
Yeah.
of your own health.
Yeah. I do.
Is that okay? Okay.
Yeah.
We'll get that done for you today. We can give you the results in about 20 minutes.
Okay. Good.
Okay. And what you just saw was the behavioral counseling strategy that I used with April. Remember that April had not been sexually active for 5 years. And so her target behavior for HIV prevention would be to have an HIV test today since she hadn't been tested in 12 years. But she was pre-contemplated for that goal because she saw no need for testing because she hadn't had sex for 5 years. So the behavioral counseling strategy that I used is called Impact on Others. And that is a strategy derived from the trans-theoretical model of behavior change theory. Information giving is one that you saw in a previous demonstration, but this one is called Impact on Others. So I was exploring the impact that her period of time between her child's birth and 5 years ago when she stopped having sex, you know, was a period of time where she was involved with a lot of different partners, some of whom were drug using and possibly sharing needles. And the idea that HIV that could have been transmitted at that time, how that might impact on her and her life today and on her children. So it got her to see the situation differently and to thus see the need for an HIV test, whereas prior she was pre-contemplative and didn't see that as an important effort for her today. These demonstrations were demonstrating both taking a sexual history, but then also conducting a behavioral risk assessment followed by using a behavioral counseling strategy that matches the patient's readiness. And this is a method of behavioral counseling that we provide training for here at the New York State STD Center of Excellence. We provide classroom training on what we call our stage-based behavioral counseling, or you can sign up for a preceptorship and come to the STD clinic and see the nurses and nurse practitioners who are seeing patients in the STD clinic performing the behavioral risk assessment followed by the behavioral counseling strategy. And so you can see sort of live stage-based behavioral counseling in practice.